by Beth Revak, a lung, head, and neck cancers nurse navigator with Sentara Martha Jefferson Hospital. She's sitting down with Aaron.
Beth, thanks for coming in today.
Yes, thanks.
You're very welcome.
The opportunity.
Absolutely. You're here to talk about a pretty important topic, head and neck cancer, and the signs and symptoms that people should be aware of. So can you help us understand what cancers fall under that umbrella of head and neck cancer?
Okay, so head and neck cancer is specific to the lips, mouth, the oral cavity, the pharynx, which is the back of your throat, all the way down to your voice box, your larynx, and the epiglottis, which is the little flap that goes over your larynx when you're swallowing, so things don't go down your lungs. So it doesn't account for brain or eye or ear or skin cancers of the head. So it's specific to those areas.
Got it. That is good to know. And what are some of the most common signs and symptoms of head and neck cancer?
Yeah, it's an interesting question. I like that we segued in with a piece about brushing your teeth, because it's important to see a dentist if you have any sores in your mouth or on your lips that aren't healing, if you have trouble swallowing, if your voice changes, anything like that. You should have a dentist take a look at your mouth just to make sure that there isn't something going on there that could be early signs of head and neck cancer. At this point, there isn't a standard screening test for it. So, we often have to wait until somebody develops symptoms.
Gotcha, okay.
Yeah.
And are there any certain risk factors that increase someone's chances of developing head and neck cancer?
Sure. Obviously, tobacco use, whether you chew it or smoke it, that increases the risk of head and neck cancer significantly, all cancers really. And alcohol use increases your risk for head and neck cancer. The last 20 years or so, the human papillomavirus, HPV, has increased the rate of head and neck cancer by actually hundreds of %.
Wow.
Yeah. So, and that type of cancer, an HPV-related cancer, really can occur in people who haven't smoked ever.
Wow.
So it's a sexually transmitted infection. So it's much more easily cured than cancers caused by tobacco, but it's a lot more common.
Right.
Yeah.
And how does early detection make a difference in treatment and outcomes for patients?
Well, it makes a difference in every type of cancer or in every type of disease, really. The earlier it's treated, the less vigorous, the earlier it's caught, the less vigorous the treatment has to be.
Right.
Yeah, and it's not an easy treatment. Head and neck cancer is not an easy treatment.
Oh, that's sad to hear, but I'm glad that there's support and there's resources available at Sentara Martha Jefferson.
Absolutely. Absolutely.
What type of support can patients expect?
Well, navigation support, certainly for head and neck cancers and for all types of cancers. We have otolaryngologists, we have radiation oncologists, medical oncologists, speech therapy, swallowing therapy. We can do pretty much anything the patient needs.
That's
if
amazing.
They're diagnosed, yeah.
That is wonderful.
Yeah.
Well, I'm glad you all are here.
Thank you.
Doing what you do to help patients. So we appreciate all that you do, and thank you for coming in today, Beth.
Thank you for asking.
You are very welcome.
All right.
Steve?